Chlamydia is a common bacterial STD that is easily curable with a prescription of antibiotics. It is caused by the bacterium Chlamydia trachomatis, and is the most commonly reported STD in the US. An estimated 2.86 million Americans get chlamydia each year. Chlamydia is spread through vaginal, anal, and oral sex. It can also be spread via shared sex toys. In addition, chlamydia can be passed from mother to infant, during vaginal childbirth, causing pneumonia and eye damage in the newborn. Screening and treatment of chlamydia in pregnant women is the best way to prevent neonatal chlamydia. Anyone who is sexually active can get chlamydia, especially if they are having unprotected sex. Chlamydia is particularly common in young people ages 15 to 24, who account for almost 2/3 of all chlamydia cases. An estimated 1 in 20 sexually active young women, between ages 14 to 24 has chlamydia. Most people who have chlamydia don't show any symptoms, but this doesn't mean you shouldn't get tested. If chlamydia is left untreated, it can cause irreversible damage to your reproductive system, or even infertility. Many people with chlamydia don't have noticeable symptoms. Those with symptoms present 1 to 3 weeks after exposure to the bacteria. For women, symptoms can include abnormal vaginal discharge, painful or burning sensation during urination. If the infection spreads, women can experience abdominal and pelvic pain, fever, nausea, bleeding between periods, and pain during sex. For men, symptoms can include painful or burning sensation during urination, unusual discharge from the penis, pain and swelling in one or both testicles. For both men and women, symptoms of rectal infection may include rectal pain, discharge, or bleeding. How often should you test for chlamydia? The Centers for Disease Control (CDC) recommends at least yearly chlamydia screenings for women under 25, and women older than 25 if they have risk factors like new or multiple sex partners, or partners with an STD. The CDC also recommends that pregnant women get tested for chlamydia. All pregnant women should be screened for chlamydia during their first prenatal visit. Retesting in the 3rd trimester is recommended for pregnant women younger than 25. When should I test for chlamydia? If you've recently had an experience that you believe may have put you at risk of chlamydia, doctors recommend waiting at least 1 to 5 days post-exposure to be tested. For the most accurate possible results, you should get tested 2 weeks after potential exposure. If you have undergone chlamydia treatment, you should be tested again 21 to 28 days after treatment has ended to verify that the bacterium has been eliminated. If you have tested positive for gonorrhea, you should be tested for chlamydia. These infections often coincide, and the symptoms are very similar. If your chlamydia test results come back as positive, then the bacterium Chlamydia trachomatis was found in your system, and you do have chlamydia. Chlamydia is entirely curable by treatment through antibiotics. So, how do you prevent chlamydia? Abstinence is the only way to be sure you will not get chlamydia or any other STD. However, if you do have sex, there are ways to reduce your risk. You can decrease your risk of contracting chlamydia by 1. Using a latex condom or dental dam every time you have oral, vaginal, or anal sex. 2. Being in a mutually monogamous relationship with someone who has tested negative. And 3. Limiting the number of sexual partners. If you or your partners have symptoms or you think you may be infected, get tested before having sex again. If you test positive and get treated, you should notify your current and recent sex partners, so they can get checked and treated too. Subscribe to our channel for more health-related videos. Thank you.